Okay, well, got 14 people. Maybe in the interest of time, we'll just start and people will join as they can. So welcome to session 2A, Advancing Equity and Innovation in Health Research and Practice in Northern BC. We've got three wonderful groups of speakers here today. So we'll start off with Brooke Boswell and Victor Lau. I might be saying your name wrong, so I apologize if I'm doing that, but I'll
That's
pass it
okay.
over to you both right now so you can start off and we'll try and I'll give you kind of 5-minute warning just so you kind of have a sense of when to
Sounds good.
go.
And
Okay.
just audio, because I realize I don't see any faces once I bring up my presentation.
Right.
So
Right. Yeah.
thank you.
You sound great.
Um, yeah, so Victor Leo is with us, and I'm just going to put this into presentation mode. So here we go. So Illuminating Voices, collaborative dialogues to advance equity in physical activity and health outcomes with and for people with intellectual disabilities in Northern BC. And we'll get right into our introductions. Taro Manyanga is an assistant professor at UNBC and a physical therapist, and he should be joining us for this session, but he might be having some of the difficulty that others are having coming in. He's also been so gracious. He's got some leadership in this conference going on as well, so he's been so gracious as to let Victor and me know that we should take the lead and kind of run the presentation, so he'll join us when he can. And then Bailey McClem is not with us today, but she's a health coordinator at Special Olympics BC. She has particularly she leads healthy athletes, which we'll talk about a little bit later on at SOBC. Okay, and I'll let Victor introduce himself as well.
Hello. My name is Victor. I am a research lab manager at the Division of Medical Sciences, and I currently work for Dr. Kendra Ferber, and we're looking at how to build a brain, what happens in aging and multiple sclerosis. But my previous background training was in looking at novel anti-cancer therapies under the supervision of Dr. Charlie. So mine is very molecular-based research.
Mm-hmm. And Brooke Boswell here. My background is in First Nations and Indigenous community health research. So going out to some of our small remote communities that are kind of dense, not densely populated, far from healthcare centers, to meet people face to face so that we can actually find out what their health needs are and report that back to the healthcare system for change. Yeah, so I'll move on now to our presentation. So one of the stories we like to tell, we basically came into this research question in January or February this year. So this is a very nascent initiative, and we haven't actually gotten to the point of data collection yet. So we wanted to start with just the story of how we got here. And to begin, there were some particular events in Special Olympics that occurred that Victor is going to take us through.
Yeah, and so I had the honor of volunteering at the recent 2025 Special Olympics Games as a director of protocols and in the organizing committee, where I look at how to deliver medals to athletes. But shortly in the planning session in January, we got an email or call out that the city of Prince George wants to bid for the 2030 National Games. And so I thought the bid was due on March 1st. There wasn't too much time, and I thought I could lend some words to that at the very least. And so I was there. We met for a few meetings. We had like discussions on event hosting, and we have everything in the community to power this. But for every bid, we always want to know what is the legacy of hosting. And so this is one thing we haven't really addressed. And so I took the weekend and thinking, if we were to mention anything, what would that be? What would be the maximum version of it? And I propose improvements to health outcomes for persons with intellectual disabilities. And so that kind of stuck. And with luck, we ended up submitting this bid. We got shortlisted recently, and the committee visited in October 7th and 9th recently. And you can see the McCaffrey building was recently activated to like host a site evaluation committee. And it was a very community and collaborative experience. Has a Brooke.
And yeah, and so July 10th to 12th was the Special Olympics Summer Games here held in Prince George. Very inspiring and provided a lot of momentum. And many of the people that you'll see in these photos are, we've talked to many of them, and they're very supportive of this research initiative that was prompted by Victor wanting improvement of health outcomes for people with intellectual disabilities in Northern BC to be something that we can work on and improve as a legacy item. So one of the things that happened in terms of my involvement was as Victor was writing these. Oh, and before I go on, I just wanted to mention that Taru Manyanga, he says that he's in the waiting list for the Zoom link to get into this session.
He should be in now.
Okay.
He's been admitted.
Okay, great. Thank you. All right. So so as Victor was writing these legacy items, Victor's my fiance, so we were talking about this at home as he was writing these legacy items, and he came to me and he said, "What do you think?" And I started seeing, health and health outcomes and things like that, and I thought, oh, this is starting to get a little bit into kind of a community-based research aspect, or kind of into my field of things. And he asked me, how do we improve health outcomes for people with ID? And I said, well, first it would need to start with knowing who are people with ID in Northern BC. Do we know how many people will have intellectual disability in Northern BC? And from there, once you identify who they are, it would be a matter of talking to them. And sometimes, the identifying the group and beginning to talk to the group kind of is one and the same process. But it would mean getting to know the group and building trust with them as researchers so that they would feel comfortable and confident in talking to us about what their health needs and concerns might be. So then I don't know if Taru is in and able to speak to a point here.
Just in time. Thank you.
Okay. So
thank you so much.
Yeah, so I wanted to mention that we started looking into literature on physical activity and the effects of health on people with intellectual disability, especially in northern rural areas, and we found very sparse literature on that, particularly in northern BC. But I wanted Taru to introduce himself and then give us a really quick point about the connection between physical activity and health.
Thank you very much. I'm part of the team. I'm Taru, physical therapist and researcher at UNBC. Without wasting too much time, I do research mostly in physical activity space. We know that there is a direct link, the evidence between the physical activity participation and health is unequivocal. So we know that there is also a canyon of difference between health outcomes for people with intellectual disabilities and people who are apparently health. And this gap is worse in rural and northern communities. In fact, we have very little information, and the little that we have tells us a lot about the inequity in terms of access to physical activity, which we know is very important for health. And the irony about it is that in northern and rural communities, if people have access to participation, it's easier to manage many problems or health conditions. So I'll stop there.
Thank you so much, Taru. So we can infer that physical activity overall will improve health for human beings. And we've also seen in other geographies research that has been done on the linkage between physical activity and health for people with intellectual disability. So we feel confident that we can infer that to our population here in northern BC. But of course, we do want to, in a community-based participatory action sense, definitely make sure that we talk to our own community members to avoid the risks of ecological fallacy and so on. So after Victor had shared with me these legacy items, he came to me very quickly afterwards and was like, hey, there's this BC Rural Health Conference coming up. And I said, when's the abstract due? He's like, in 2 weeks. So I said, you might want to bring me on board to help you write this abstract. And so we met quickly with Taru, and we also spoke with Bailey. And in that sense, we began our partnership between UNBC and SOBC, starting with the Rural Health Conference. And Adam Spokes on the right here is one of the 3 Prince George athlete ambassadors. They usually only choose one, but in Prince George, we came forward with full spirit and 3 athlete ambassadors applied. And so Adam Spokes is one of the 3. You'll see a picture of them later on. But the health conference was so hospitable as to allow Adam to join us free of charge to be there for the poster presentation and have lunch with us. So this one, I'm taking this one, Victor?
Yes.
Yes, okay, just to be sure. So, and on the right here are the three athlete ambassadors, Adam Spokes, Chase Carone, and Marinka Van Haag, and we've had a wonderful time getting to know them. So we know that we use the word in community-based research, the term nothing about us without us, which came from European labor rights movements. And we tend to use nothing for us without us here because of the idea of writing about communities without their participation or their consultation with them, or writing policy and things like that without their consultation. So in this case, we want to make sure, as we do in community-based research, to work with this community and make sure that they have the voice in their kind of guiding research questions based on their needs. We did apply for the Vancouver Foundation Convene Grant, which they just released their results a week or so ago, and we didn't get the Convene Grant. Unfortunately, they did say that they had numerous applications, definitely far more than the funding that they had available. So we will try again. But as part of doing that, we had to list co-investigators. And so Taru reached out to many of our lead community members, researchers, leaders at health authorities, and we're able to pull together quite a large group of people that are very supportive, who we'll go back to as we go back to the drawing board of our research design, which we'll share in a moment. And of course, that also formalized our partnership between UNBC and SOBC that much more. And yeah, so next we'll talk about our key informant meeting. So when we say that there's little...
You have 1.5 minutes, Brooke.
Okay, thank you. When we say that we have very little research literature, that doesn't mean that we don't have knowledge. So we have a lot of volunteers. Peter Goodall in the picture beside with his son. He's one of these volunteers. He's a parent of his son with intellectual disability and a volunteer, a coach, and wears many hats in this community. So we're talking to him about the key informant meeting that we will be designing. I'm going to go through these quickly. We're going to talk about establishing an advisory committee, talking about potential for records harmonization to figure out accessible, up-to-date data on people with intellectual disability in Northern BC. Is there a path forward for us to be able to do that? Asking the people in the room what their health needs and concerns are of people with ID. So specifically, very strongly leaning on people with ID to tell us ourselves, as well as family caregivers of people with ID, and exploring and optimizing healthy athletes data, which I'll allow Victor to explain briefly.
The Special Olympics have a movement of healthy athletes. This is to give more reach to screening, more opportunities. They have different disciplines, and we invite specialists to fulfill this. But within healthy athletes is collection of data that we can find through historically in their games. And from there, we can learn how to serve this community better through analysis of this data. And perhaps we can propose new analyses moving forward.
Okay, thank you. And so just a quick session breakdown. I don't think I need to go through those points, but that's just a breakdown of how we'll plan each session. And I'm going to move on to this slide, which I think Victor is going to lead.
Our idea is to just improve all aspects of livelihoods for persons with intellectual disabilities in a very comprehensive way, with access to funding, improving visibility and community outreach, improving education for allied health and medicine, and for persons with intellectual disabilities, improvements of capacity in sport, and to really understand their livelihoods. And so we use the momentum from our recent games to have these transformative conversations and really put momentum into these projects. And we're hoping to foster new partnerships.
Okay, and that's our presentation. Victor might have just something quickly to say about this collage.
Yeah, I'll just mention it does take a community to bring any movement forward. And it's in our history where if there's a need, the community will voice themselves and show up. So this is evidence in having UNBC, Northern Medical Program, BC Cancer Center of the North, and so forth. So
and SOBC Prince George.
That's right.
Yeah.
And we can all come together to have meaningful discussions and have co-creations of initiatives.
Excellent. Well, thank you so much. And I really apologize for those technical difficulties. We're gonna try and do what we can to kind of keep things moving so that the other presenters also have some time to present their work. But wanted to
Sounds
ask
good.
if
Thank
there's a
you.
question or two that anything coming up? It's really interesting work. Congratulations on
Thank you.
a really wonderful project. Okay.
I saw it. Was that a hand that raised by Nicole? Or was that a,
I think it's a
okay.
clap.
It was
Yeah,
a clap. Okay,
it's a
thank you.
clap. Excellent. Excellent
Okay,
work.
sounds good.
Okay, well, thank you so much. I guess at this point we'll turn to our next presenters. And if you do have questions or comments, I'm sure you could reach out to Brooke and Victor if you wanted to chat more about their project. But thank you so much, Brooke and Victor.
Thank you.
Okay, and sorry for all the rushing. I
No
feel
problem.
bad
Thank
doing
you.
it.
It's good. It's
Okay,
good.
okay. So our next presenter, we've got Sandra Harris, who is going to be up next. So I'll turn it over to Sandra. If Sandra's in the room, let's hope Sandra was able to join. Is Sandra here? If not, what we could do is move to the third group while we wait to see if we can get Sandra on. Does that sound okay? I'm not sure, Terry and Christy, if you'd be willing to kind of jump in at this point. Okay, we'll just turn to you then. Sorry
Yeah,
about that.
sounds good.
We're being flexible on the fly here. So I'll turn it over to you then.
Thank you. Okay, let me just make sure that I can share the right screen.
Take your time. You're good. We can see your screen.
Oh, great. Thank you so much. All right, and I'll just take a look at the time here. And move that. Okay. Yeah, I think everything is good to go. So hi, everyone. Thank you so much for joining us. We are very happy to be here presenting our project today titled Comparing a Simplified ChatGPT Prompt to a Complex Prompt Sequence to Build a Search Strategy for Scoping Reviews. My name is Christy Hancock, and my co-presenter is Terry McKellar. We are both librarians at UNBC. Terry is the Knowledge Synthesis Librarian, and I'm the Division of Medical Sciences Librarian. And before we dive into our project, we did want to really highlight that in our roles as librarians and information specialists, we both have a really keen interest in the way that artificial intelligence impacts information-seeking behavior and the knowledge synthesis process. We are not, however, experts in the technology that underpins those AI systems. So that just gives you a bit of an idea of how we're coming to this topic, given our roles and our areas of expertise. Okay, so if anyone is new to the term knowledge synthesis, it's an umbrella term for literature reviews that use rigorous and reproducible methods to select and synthesize all existing evidence on a topic to answer a research question. Knowledge synthesis is important to evidence-based practice and quality improvement, and there are also different types of knowledge synthesis. Some of the more well-known types include systematic reviews, scoping reviews, and integrative reviews, and each of those really have their own unique purpose. Today, we're going to be talking about scoping reviews, which aim to describe the nature and extent of research on a topic. And we also wanted to very quickly highlight some of the main steps in the knowledge synthesis process. Those steps include planning, searching, selecting studies, extracting data, assessing study quality for certain types of reviews, and finally analyzing and synthesizing your data. And today we're going to be mostly discussing the search stage. Okay, we know a lot of folks probably have a pretty good understanding of Gen AI at this point, but we still wanted to provide a definition. And so actually we asked ChatGPT to define Gen AI for us, and this was its response. Gen AI refers to a type of AI that creates new content, such as text, images, audio, video, or code, rather than just analyzing or classifying existing data. GenAI systems learn patterns, structures, and relationships from large data sets, and then use that knowledge to produce outputs that resemble human-created work. So just a quick definition to make sure that we're all sort of on the same page. Moving into the background for the project, we came to this work already knowing that in the context of information seeking, GenAI outputs can sometimes include things like fake citations when you're using a GenAI tool to search for literature, as well as fake subject headings if you are, say, asking a GenAI tool to create a database search for you. So that's what we already knew. There's also been some prior research exploring whether ChatGPT specifically can be used to generate systematic review searches for PubMed, and two of those studies actually informed our own project. So the first was the Wang 2023 study, and then the Howell 2025 study. Both of those studies really informed our project. Our rationale for this work partly comes from our interest, again, as librarians, in the opportunities for and limitations of using GenAI to support knowledge synthesis work. And given that prior research in this area has really focused on using GenAI tools to create PubMed searches for systematic reviews, we wanted to know if ChatGPT could create a search for CINAHL, which is a paywalled database, whereas PubMed is a free interface to search the Medline database. So a bit of a difference there. Anyone can use PubMed, whereas CINAHL is paywalled. And scoping reviews are particularly popular among nursing and other healthcare profession students. So that's why we chose to focus on scoping reviews rather than systematic reviews. Our primary research question was as follows: can ChatGPT generate CINAHL searches that are logical and comprehensive for scoping reviews? And our secondary questions focused on differences in ChatGPT search quality when using a simple prompt compared to a complex prompt. And finally, we were interested in whether the ChatGPT searches could retrieve all of the included studies from a scoping review compared to a CINAHL search developed by a librarian expert searcher. So moving into our methods, we started by identifying 6 published scoping reviews for comparison. So that was our test set. We then developed and executed the ChatGPT prompts. After that, we evaluated the structure and syntax of the ChatGPT searches. And then finally, we compared the ChatGPT search retrieval to that of the human developed CINAHL search. We did have some selection criteria when searching for those comparison scoping reviews, and I won't get into all of the details here, but I think the most important thing to know was that we specifically searched for scoping reviews that had a librarian co-author who developed the searches. And again, our reasoning behind that was that we wanted to compare the ChatGPT searches to searches developed by an expert searcher. And then when actually developing and executing the prompts, we used ChatGPT 5, and we both used free accounts. And then we did test 2 different prompt approaches, a simple approach and then a more complex approach. So we'll show those here. So this is an example of a simple prompt. As you can see, it's very short and sweet. Essentially, it contains a very brief command and then the study objective from our comparison scoping review. In comparison, this is the complex prompt sequence using that same study objective. But as you can see, there are 4 separate prompts, and each prompt is very, very detailed and specific. And we actually used the complex prompts from the Wang study and then adapted them for our project and scoping reviews specifically. Okay, Terry, over to you.
Hi, great. So moving on to the results. Next slide, please. So Christy mentioned the press guideline earlier, and this chart shows how the search strategies generated from a complex series of prompts performed in the review, the press review. Red indicates revisions required, yellow revisions are suggested, green, no revisions. You can see a fair amount of revisions are required, primarily in the question translation and subject heading domains. Next slide. Very similar results for the searches generated from a single prompt. Next slide. So let's look at each domain individually. We'll start with translation. We can see that there were a significant amount of revision required here. This is the translation of the research question, that study objective, into separate search concepts. It's not surprising to see errors here, as this is a challenging and nuanced task. As an example of an error, one of the research objective statements was to examine point of care ultrasound testing in post-acute and long-term care settings. ChatGPT interpreted this as point of care ultrasound in long-term care settings and a geriatric population. By specifying geriatric populations, the search strategy would miss articles that look at point of care testing in post-acute settings that don't use that defined population. ChatGPT also had some problems with combining search concepts correctly, often including different concepts in one concept block, such as caregivers combined with program evaluation. It was using these terms synonymously. Next slide. Thank you. Boolean and proximity operators, but primarily Boolean operators, are how we build our searches. These are the ands and ors when you build a search. There were a few errors here, including one of proximity operator, that it used the wrong database language. So they're very specific to the type of database. For the Boolean operators, this actually tied back to the difficulties we saw with correctly identifying discrete concepts in the search question translation. Next slide, please. Subject headings were a big one. So there were many small non-critical errors and also errors that would result in searches being either way too broad or too narrow. However, the biggest issue here was the fabrication of subject headings. ChatGPT just made them up in almost every search. Not all of the subject headings, but it made up a significant amount of subject headings. Next slide. We can see here that both the complex prompt and the simple prompt results in an average of 30 to 40% of fake subject headings of all subject headings generated. Although this does not actually cause the search to fail when you run it in CINAHL, it does not do anything to assist your search. So now you have a search that appears robust, but it does not actually search what it is claiming to. In many cases, there were other real subject headings that ChatGPT could have used. Next slide, please. Text word searching. Some important keyword variations were missed, and some truncation was either too broad or too narrow. Nothing catastrophic, but definitely room for suggested revisions. Next slide, please. Not a lot of issues here with spelling and syntax. Thankfully, no noted spelling errors. We did note that in the complex prompt search strategies, we had asked ChatGPT to use field codes to specify searching in the title and abstract fields. But it didn't do it, which was odd. Next slide, please. These ones are pretty quick. No errors here because no filters were used, and so none were recommended. So when we see that column of all green, it's just because it did nothing. So we didn't have any suggestions for it. Next slide, please. So with all of these errors, how did these search strategies actually perform? What this chart shows us is that the number of, so the first column is the number of total articles used in each review paper. The second column is how many of those articles could actually have been retrieved in CINAHL, and then how many articles were retrieved by the librarian-generated search, the complex prompt-generated search, and the simple prompt-generated search. Next slide. So here we see the precision of each search by percentage. So that same chart, but the last three columns shown in percentages now. Of the number of articles the search could have retrieved, what was the percentage that was actually retrieved? We could see that 2 of the complex prompt generated searches actually performed better than the librarian generated search. But overall, the ChatGPT searches had a lower recall rate than the librarian generated searches, by a not inconsequential amount. Next slide, please. Sorry, we're flying through this. Some limitations of our study. We were relying on the objective from the abstract to be descriptive and clear, but in some cases that was not the case, and the objective perhaps did not provide enough information about the scoping review topic. We did not ask ChatGPT to fix mistakes or give it an opportunity to clarify or refine its search. Not all questions had 3 concepts to build for the search to match the framework that is typically used of population, interest, phenomena of interest, and context. However, we did not ask this of the simple prompt, and it's actually still generated those 3 concepts in its search, which was interesting. In general, our sample was very small, only 6 papers, and we only tested ChatGPT. We didn't look into other generative AI that might be more specialized in this kind of a task. Having said that, we just felt ChatGPT was probably the most common system that people would jump in and try. Next slide, please. In conclusion, so returning to our original research questions, a big issue here is that all of these search strategies appear logical, but they are functionally incorrect. The fake subject headings appear very real. They were not outlandish or strange or misspelled. So there was nothing that you would look at and think, if you weren't informed about what the subject headings should be or could be, there was nothing that made them obviously wrong. And it's very easy to take the search strategy that ChatGPT generates and cut and paste it directly into the CINAHL search bar. And it will run perfectly fine and it will not report any errors. So you have no indication that it's not performing as you are expecting it to. There were no consistent differences in ChatGPT search quality from the single to the complex prompt. Both displayed non-critical as well as significant errors on the press review. The complex prompt did perform better than the simple on average in terms of identifying relevant articles, 47% as compared to 37%. We know that there's a lot of importance placed on search prompts or generative prompts. And so that was really what we wanted to see was, if we did this detailed prompt, would we get something much better than if we just entered a very straightforward basic prompt. And so there was some improvement, but perhaps not as much as we would hope, and perhaps not up to the level of that librarian-generated search. On average, ChatGPT searches did not perform better in terms of retrieval precision compared to the librarian search. And then overall, while ChatGPT prompting can assist with keyword generation and even help with understanding the structure of building a search, a human is still needed to at least review it and actually validate it. And you still have to go through and check and review every single component of that search to make sure that it's real. Thank you for listening to that very fast chat. Are there any questions?
That was excellent. Thank you so much, Terry and Christy. That was awesome. What an interesting study. Really, really timely. I think more and more of us are using these types of search engines with AI.
Yes.
Yeah. Okay, I'm just looking. We might have time for a question or two. I think I saw Sandra Harris join. I just want to make sure too that Sandra is okay to jump in next with her presentation.
Yeah, I'm ready. Thank you.
Okay, awesome. Any other questions? I don't see any hands up. Sorry if I'm missing anyone. Let me look in the Q&A.
I have a question in the
Yes, Victor, what are your thoughts on researcher-curated AI programs that are advertised?
Yeah, I've used a couple of those, and like those research programs that will help you find other articles, and then one that will actually do data extraction for you and do synthesis for you as well. And I will say it's actually quite scary how well it performs. Having said that, the caveat to all of this that I find is, regardless of how good it looks, you always have to go back and read through every aspect of it and validate every aspect of what it's putting out, because you can never guarantee that it's accurate. And if you need to use it for something, especially clinical decision making, you need to be able to stand behind that 100%. So while it does an apparent good job, when I've used them, I've still gone back, checked what it's the information that it's using, and it's not always interpreting it exactly as perhaps the original authors intended it to. Assisted is a very good word that we should, it's just an assistant. It's not meant to replace, that human generated work. It's a bit scary though, how well it does. And I always try and remember that what it is right now, this is the worst it's going to be,
Right.
Which is kind of scary how good it could possibly get.
Excellent.